Hello, Mrs. Smith. I am Laura and I will be taking care of your husband Bill. How are you doing?
I am fine, but I am worried about my husband.
No need to worry, he will be fine. I understand that he is going to have surgery today.
Yes, he keeps passing out and he has a very slow heartbeat and the ER doctor says that he will need a pacemaker.
Our team of electrophysiologists are very good, and the nurses here are excellent. I am sure that he will be fine.
But we have not met his doctor yet and I do not know what time his procedure is supposed to be today.
I am sure that his doctor will see him before surgery and answer all of your questions.
I know pacemakers are safe and that it will help him, but I am very worried about infection. I have a friend that got a pacemaker and then when it was replaced years later she had a serious infection and they had to remove her pacemaker and leads using a laser and it was very dangerous. She almost died, and then she had to have a temporary pacemaker and stay in the hospital for 6 weeks on an IV and get very strong antibiotics and then get a new pacemaker on the other side. Her scars look hideous and she lost her job as an exotic dancer.
That sounds terrible. I hope she is okay now. But don't worry, our EP labs have a very low risk of perioperative infections.
My friend thinks that her infection happened because someone did not wash their hands, or maybe came from all the disgusting men she met at work. I noticed that not everyone that came in here to see my husband used the alcohol scrub on the wall every time that they interacted with him.
Please remind your healthcare workers if they don't use the scrub, foam in, foam out, that is what we say at Baylor. Our doctors are not very good about the foam and I frequently have to remind them also.
They said on Google and WebMD that he should have had a scrub with Hibiclins last night and again this morning. Why was that not done?
I am sure that the EP lab will clean his skin well before the surgery today. Any other concerns?
What about that ECG electrode? Isn't it right where the pacemaker is supposed to go? He is so allergic to adhesive I can already see it getting red and inflamed around the edges of the electrode. I was surprised to see that the tech put the electrode in that location.
Well, Mrs. Smith, why don't I get some Hibiclins scrub and move that electrode before he goes to surgery today?
But why did they put it there anyway? That seems dumb. Doesn't everyone know that he is supposed to have a pacemaker put in today?
There now, Mrs. Smith. I have moved the electrode to his shoulder and am doing the Hibiclins scrub.
What about all that sticky adhesive on his skin? The Hibiclins will not remove it and WebMD says that the adhesive will trap bacteria and increase the risk of infection.
I will see if I can find some adhesive remover.
Thank you. And are you going to trim the hair from my little bear's chest? WebMD says that you are not supposed to shave preoperatively.
Yes, we would trim the hair, but our hair trimmers can never be found. I think some of our young staff must take them home for personal grooming.
I think it is a waste to prep his skin without trimming the hair first. And my baby is such a pig. I am sure he has not showered in days since he was off hunting with his buddies the last few days until he started passing out at deer camp.
Let me see if I can find some hair trimmers and then let's use the adhesive remover followed by a shower and Hibiclins scrub. And let me put a better IV in his left arm because his doctor always wants an IV in on the side of the implant.
Just one more question. What is his INR? I am pretty sure that he got his Comad in last night even though I told that sleepy intern that his INR has been high recently and he probably should not order his Comad in for last night, but I don't think he was listening because I tend to be such a troublesome busybody.